There have been a whole host of studies and articles and official government statements about loneliness and its impact on our health. And so we would not be doing our job if we didn't at least talk about it. So on the front end, we don't have a solution for people who are lonely other than the obvious things. This is not going to be groundbreaking in that sense that we're going to offer a magic pill. You know, if you're lonely, all you need is probiotics. That's what I've heard. That's not the way it works. But we do need to talk about it. According to a new study from Pew, 8% of Americans say they have no close friendships, and another 7% say they have only one. Even before COVID-19, half of all U.S. adults reported experiencing measurable levels of loneliness. According to the CDC, loneliness and isolation have been linked to an increased risk of type 2 diabetes, depression and anxiety. That makes sense. Addiction, suicidality and self-harm, early death, heart disease, that would be a 29% increase. Stroke, that would be a 32% increase. Dementia, that would be a 50% increase. A 2021 online survey found that 61% of young adults and 51% of mothers with young children feel serious levels of loneliness. The CDC also found that 63% of young adults suffer significant symptoms of anxiety or depression. In 2022, the AMA declared loneliness a public health crisis, and this past summer, the U.S. Surgeon General released a general health advisory raising the alarm about this growing problem. It's a big deal. And that's the cut short version of all the stats I have that I was able to find without a whole lot of searching. There have been a lot of studies done about loneliness and how lonely and isolated everybody feels right now. It seems self-evident, but for the sake of these conversations and because when you're doing research, you have to define these things. What is loneliness in these clinical terms?
It is a subjective, unwelcome feeling of lack or loss of companionship. It happens when there is a mismatch between the quantity and quality of social relationships that we have and those that we want. So that's the part that I think should and will resonate most with the listener. The mismatch between the quantity and quality of social relationships.
Yeah. So it's what you want versus what you actually have.
Mm-hmm.
And so it can be different for everybody.
Exactly.
If you're a hyper extrovert like me, then if you don't have at least 30 very close friends, you feel isolated. And if, you know, I have a friend that's a complete introvert, and she has like one or two close friends, and she is perfectly happy with that. She doesn't feel like she needs any more than that. So she's fine, but that's not normal. It's, you know, it is all subjective.
Right. Right. And with some of that nuance is that people who you often wouldn't, I know this is kind of what you're saying, but there are people who you wouldn't think, oh, there's no way that person can be lonely or experience feelings of loneliness.
Right.
There's no way. Every time I see them, they're with a new group of friends. They live in a great neighborhood. They work for a huge company. There's no way.
Right.
You know, but it doesn't quite work that way.
Right. Because it's not about, this is a big point. There's a difference between being alone and being lonely. Mm-hmm. That just because you're alone doesn't mean you're lonely. And just because you're not alone, you can be completely surrounded by people, family, friends. The holidays are a perfect example of this. There are people who are surrounded by family and friends and yet are still going to feel totally isolated because they don't feel like anybody understands them or what have you.
Yeah.
Yeah.
Yeah. And as an aside, that definition that I read, it's from the Campaign to End Loneliness out of the UK.
Wow.
And so just as an example, you have an entire country taking this very seriously. There's a minister of loneliness in the United Kingdom.
What a horrible job.
I was going to say, what a title.
Jeez.
Yeah. The point is that it's, I think what we're doing is we're talking, being on this platform, it's a balance of public health messaging and also talking about individual situations, talking about practical things that you can do. But the point is, this is something that has to, like the obesogenic environment, the challenging food environment that we're in.
Yeah.
There's a lot of things that we can do and should be doing and should be trying to do on an individual level, but there's often a top-down sort of policy shift or things that have to occur, medications that are formulated and such. So this is a big issue. I can see why a country would be incentivized to, sort of get behind a big messaging board like this.
Yeah. It was, and especially after lockdown and COVID-19 and kind of that enforced isolation that we all kind of went through. I think I know personally, I had my family and that was great, but I'm a hypersocial person. And so within a week I was feeling itchy, like, where is everybody? I need to talk to some people. And I spent a not small amount of money to buy a game so that I could be online with my friends and we could all play a board game digitally because I desperately needed some sort of connection. And it's a little, it feels embarrassing to say that I needed that quickly, that what's wrong with me that I can't be alone for just a little while. But it's true. I mean, I felt it quickly, and I know I'm not alone in that. I mean, that's me. I felt deeply alone during lockdown. I'm sure there were plenty of people who didn't experience it that way. So let me take it out of that. Have you guys, does it jump to mind? Is there a time when you have felt incredibly lonely or deeply lonely?
I think in general, it's normal for people to have to experience loneliness.
Right.
It's just going to be to different magnitudes. And so in much of the research that we've shared with one another, one of the common themes that comes up is that loneliness is almost is part of the human experience, like hunger and thirst. And so to some extent, given some sort of event or precipitating issue, something, it's well within normalcy to experience that feeling.
Right.
So the short answer to your question is there are absolutely times, and I think we can get into some of those. But yeah, that would be,
and that's a good point.
My
just
general answer.
Just because you have been lonely doesn't mean you're at a 50% greater risk of dementia.
Mm-hmm.
That's not what we're talking about.
Yeah, I think where it becomes a little bit more of a burden is when the loneliness continues and it almost turns into like an oppression. You're under the weight of this, and I see this quite a lot with, pastoring and talking with people and just being available for people. Is that it's these extended periods of time where so if everyone at some point experiences some level of loneliness, it's this continued oppression or feeling like, man, I am really alone over and over and over again, which leads to, quite a few other things, depression, which, maybe some of those, I wish they would parse out a little bit for us, loneliness versus depression and sadness and anxieties and worries. It's kind of all lumped in there because they're all, they all link to one another and they all exacerbate the other one.
They kind of become a stew.
I think one of the things that is important for anyone who may be listening or watching that is experiencing loneliness is almost I think Tyler, there's a lot of wisdom in what you said as far as like
What?
I recognize that I needed this. My personality is very extroverted, and I think there's so many people who don't really know their tendencies or their personality types, or there's several personality tests and types that you can find on Myers-Briggs, Enneagram. Different levels of leadership can have like a DISC test. Mm-hmm. So there's several things. I remember when I turned 30, that was a big self-learning period because there were extenuating circumstances, outside circumstances in my life that were pushing me towards this loneliness, anxiety, depression. There was just a lot going on. And I remember doing well, why am I feeling this way?
Right.
Let me take, and I'm sure we'll talk about this a little bit more, but let me take inventory of my feeling. Let me write down exactly why I'm feeling this way. Am I lonely because I'm frustrated with a relationship that has then separated me and isolated me? There are a lot of factors that go into loneliness. And I think the beginning of that article that you read, quality versus quantity, the quality of relationships versus the quantity, again, referring to a lot of pastoring and things that I do, you're only going to see more of this. Unfortunately, I hate to say that.
Yeah.
Because of the way that culture and society is digitally.
Yep.
There's a lot of things digitally that are a useful tool.
Yeah.
But can also isolate and separate. And that's where you'll see a lot more, in my opinion.
And that's one of my big bugaboos is social media. You never heard that term?
Bugaboo.
Yeah. I love talking about and hating on social media and the effect it has on society and all that sort of thing. But it has brought connection much more available, much more broadly to people. The problem is that us old folks tend to think that just because I'm talking to somebody online, that's the same as talking face to face. And it's just not. Mm-hmm. And it seems like young people are figuring out more and more that's the case.
And it's not worth their emotional well-being. Right. So like the same is true where it's like, I have instant access to these friendships or these groups. I can check in and see what they're doing. And also I can check in and see what they're doing and they didn't invite me.
And I'm not involved.
And now I'm there and not there. And it's just, I think, for younger people, it's just not worth, they're valuing, again, they're taking inventory. They're feeling, why am I feeling this way? Okay, this is a trigger for me. I'm seeing everybody out on it's just not worth it for me to be on social media. And, there are times where I intentionally like mute people on social media, unfollow, or I just myself personally get off of social media. But again, I'm sure we'll talk about that quite a bit.
We can. Dante's laughing. What's up, Dante?
No, there was an excerpt from one of the editorials from the Lancet that we discussed. And I think it encapsulates a little bit of what we're saying here as well. Quote unquote, perhaps what is needed is a recognition of loneliness as a product of how societies and the world around us are constructed. What Fang and Astel-Burt term lonely-genic environments. Our physical surroundings, dictated by urban planning, can deter social connection if they do not enable interactions and engagement. Remote work has become more common, making it harder to form meaningful connections with colleagues. Social media use, with its promises of bringing people together, has been associated with increased feelings of social disconnection. And it goes on to highlights many different larger issues, increasing in individualism, a decrease in collectivism. There's just so much of a push to be doing things on our own. And, granted, we believe, individual responsibility is great.
Yeah.
But there are certain issues in life that, this is also sort of taken from another researcher. There are certain things that you cannot solve on your own. And I think the crux of this conversation will be that loneliness is not one in it. You can't. It requires a second person. Theoretically,
you cannot zen your way out of being lonely. You can't. You can't. If the one of the main tenets of Buddhism is to have no desires. I desire to have no desires. That's one of the big things. Like you can't do that with loneliness. That's not a thing.